right, queuing up.
Good afternoon, everyone. We have a lot of people who have already tuned in via Zoom, and we're looking for more participation via Facebook. Welcome to the African American Leadership Forum, North Point Health and Wellness, Minnesota Community Care and Insight News virtual town hall on COVID-19 and Minnesota's Black community. The forum is titled, "We Good?" A question we often ask in our community. We've partnered to create this virtual town hall that considers the health, economic, and cultural impacts of COVID-19 on Minnesota's African American community. With us today are Stella Whitney-West, CEO of North Point Health and Wellness, Dr. Kevin Gilliam, family medicine doctor at North Point Health and Wellness, and Reuben Moore, CEO of Minnesota Community Care. And then we've got some other people who are also in our waiting room on the Zoom chat room, who will probably be weighing in a little bit later. And again, this is going out via the African American Leadership Forum Facebook page, and it's also going to be shared on the Insight News Facebook page. If you have any questions or comments via Facebook, I ask that you submit those questions or comments to the African American Leadership Forum Facebook page, and therefore we can get to those questions. Thank you, everybody, for joining us today. I guess the first question I have to ask of our panelists is, are we good? How's everyone doing?
I think it should be in. Thank you.
I'm well.
You're okay. Great. Dr. Gilliam, how are you doing?
Doing fairly well. I'm feeling healthy, and my wife and child are healthy. So we are good at the moment from that respect. I think, at least in the community I was raised, we good could mean a lot of different things depending on how you said it. So, we good is a question depending on how you say it. So at the moment, we good.
Good. And Stella Whitney-West, how are you doing today?
I'm well. We had an all-staff breakfast this morning, so got a chance to greet a lot of my staff members that I don't often see walk through the clinic. Everybody was asking me, "Where's your mask? Where's your mask?" I had to pull out my mask, put it on. But yes, I'm well. Thank you.
Okay. So some of the original questions that I want to start with the clinics. How are your clinics operating during this time of crisis? Are you operating at full capacity? Are there any changes or alterations that you've had to make?
Are you asking me?
Yes.
Okay.
Or Reuben.
Doctor, okay. So at North Point, yes, we did make changes in our hours for our clinic, our main campus. And so instead of opening at 8:30 for our first patients, we moved that to 10 o'clock. And then in the evening, we close our evening hours. So we operating from 10 to 5, Monday through Friday when we see patients. And then our call center, we ask everyone to call because we're trying to reduce the walk-ins. We do screenings of everyone that walks in, and then anyone that screens positive for COVID, then we move them to our isolation area, and we then do a series of additional questions and tests. Dr. Gilliam can talk more about that. And then our 800 West Broadway satellite clinic, we closed that down temporarily and moved everything to the main campus, but we still are operating out of Core McCorvey clinics. So, and then our teen clinic as well, we were operating that for a while. And then we discovered that a number of the youth who were coming in, which is a good thing, but it got to be overwhelming. So we moved that to the main campus as well.
Okay. Do you happen to know offhand about how many people you've been able to screen over at North Point? And of that, have you had those who have tested positive for COVID?
Well,
So, Dr. Gilliam, go ahead.
yeah, you know, when you say screened, you may be referring to actually testing people for COVID-19, and we've tested, somewhere between 30 and 40 people. But up until recently, the who we tested was fairly restricted. So we've screened quite a number of people, and the level of hundreds of people who come, and we ask them screening questions if they have any symptoms. But those who have presented with symptoms are far fewer, because we try to keep those people at home unless they absolutely need to come into the clinic, because we're encouraging people to call us first, because we can learn a lot through a conversation so we don't increase a person's risk and also increase the risk of those in the community as well if they actually are having any symptoms of any sort that don't require a clinic visit or hospitalization.
Okay. And Dr. Gilliam, can you kind of give us just a rundown of what is COVID-19? Just kind of, we hear a lot about it, and then I don't know that people still have necessarily a full understanding of what this virus is and how it attacks the body.
Yeah. Well, COVID-19 is the moniker given to the coronavirus. Its actual name is kind of coronavirus disease 2019. And it was, the coronavirus itself is a fairly common virus. But this is just a new version of that otherwise fairly common virus. Most of us, when we were children, likely had a coronavirus-based cold that presented as such. But this one, they started off calling it novel, which means that it's new, in that it has an affinity, so it likes the lungs quite a bit. So when it is actually it infects a person, it likes to get down into their lungs. And so that's why one of the presenting symptoms of it is shortness of breath, because it kind of attaches to the tissue of the lung and can cause people who have underlying lung issues and other underlying medical conditions more issue than some. So, the coronavirus, that there are several that are circulating in the world, except this one in particular is much more infectious than some of the others. And then when people are infected with it, it tends to, if they do get symptoms, give them more of a respiratory or breathing set of symptoms.
Okay. So early on, it was said that this virus was attacking people who were elderly, and especially before it started hitting the U.S. shores. That was the narrative. It was attacking elderly more seriously than it was attacking younger people and people who were considered healthy. Since it's made its way to the U.S. shores, has that narrative changed a little bit?
What I would say to that is it attacks everyone. It does not discriminate. So it's equal opportunity in who it will infect. It still remains true that the older population is at higher risk for problems if they do contract the infection. But everyone can get it, from little babies to very old. Which is why we caution everyone in terms of how they should protect themselves and protect their loved ones. Now, older people with chronic medical conditions, like diabetes, uncontrolled hypertension, people who are immunocompromised, so people with like autoimmune diseases, people on chemotherapy for cancer. Those people are at higher risk for getting complications or having a more serious course. But that does not mean that those who are otherwise healthy cannot get really sick, which is a really important thing to know. Fortunately, one of the saving graces about this whole pandemic is that it has not seemed to really impact the kids as much. So our children, even though they can get an infection, tend not to get a really serious infection, therefore not requiring them to be hospitalized or have other kind of serious interventions into their care.
But if a child does have it, I mean, there's certainly some best practices to make sure that that child, although they won't, in most instances, be experience a serious illness, best practices to make sure that they stay away from other people who could have those more severe symptoms. Correct?
Exactly. And you know, the issue with this particular virus is there is a 2 to 14 day kind of waiting period in terms of if you ever develop any symptoms. And there's some estimates now that about 25% of people who are positive for the virus are asymptomatic, meaning they don't have a single symptom at all. They feel normal. They're going about their regular day, their regular business. And they are unknown to themselves passing along this virus. So that's why it becomes important to practice that social distancing that we've been hearing a lot about, because this virus, all viruses need hosts. So it needs someone to pass it along. So if I have it and I stand close enough to you to give it to you, like I sneeze or cough, or I touch a doorknob and you touch that same doorknob, it now has a second host who can then pass it on. But if I keep my distance from every other person, that virus, once it runs its course, will then stop with me. And that's the point of what they say, flattening the curve. So keeping it essentially to yourself so that it does not get shared with everyone else, which, the social distancing is very contrary to, our cultural proclivities. We are a people that like to be together and near each other. So, my daughter's grandparents are hurting right now because they cannot see her. Because the last thing we want is for her, my daughter who is asymptomatic, doesn't have a symptom at all, to be an asymptomatic carrier to give grandma, grandpa a hug, and then grandma and grandpa get sick.
Yeah.
So, yes, it's a tough situation.
We were talking about this yesterday. I believe it was yesterday. The days kind of run together right about now, but we were talking about it with Al McFarlane, who's the editor-in-chief of Insight News, and he has been very open and upfront about the fact that he has some of the underlying conditions that puts him at greater risk of becoming seriously ill from COVID-19, and how they basically have self-quarantined and he can't see his grandchild except for through the window. So I think a lot of families are experiencing the same kind of scenario that you pointed out. Reuben Moore, how are you doing, sir?
I'm doing well. These are tough times for our country, our globe, and our state, especially the many different diverse, historically marginalized communities that North Point and Minnesota Community Care serve. Together, we serve almost 60,000 Minnesotans in the Hennepin and Ramsey County area. We operate close to 20 clinics. Of our 20 clinics, we're down, between us and North Point, we're down to about 4 or 5 clinics left operational as we look to develop programs to keep communities safe, to respond appropriately to federal, global, and local health guidance, to keep our staff safe. And these are just tough times. A lot of misinformation and myths in the community about COVID-19, and we're hoping that we will be still standing as in the front lines to help protect the many marginalized communities that are being impacted by this global pandemic.
So when you say you're down to 5 clinics from 20, that leaves a lot of people falling through the cracks of what would be a safety net for them then.
Absolutely. So in our organization, we went from 18 to 3. And one of the hardest closures was closing all of our high school-based clinics, because we knew that during this crisis, the 5,000 youth we serve in St. Paul would not have access to mental health services, critical sexual and physical health services, would not be able to contact and connect with their trusted primary care provider at their school, where they're comfortable to discuss their chronic conditions or other health needs that they have not oftentimes been comfortable to discuss with other professionals in the social services or in the schools or even their parents.
Well, not being able to have mental health services in this most trying time is worrisome just in that fact alone.
Absolutely. And so so what we've done is, you can't meet with your therapist in person. So we've worked, ourselves and North Point have worked to stand up telehealth programs, teletherapy programs. And we're just trying to figure out how we reach folks to let them know our services are available via their smartphones, via a phone call, that we're here as a resource. But during this time with so much misinformation, so much confusion, so much fear, it's very hard to reach the communities we serve, especially the Black community that oftentimes moves into isolation and fear quickly, because we're often hit the hardest by pandemics, outbreaks, and hardships like these.
Yeah, and Stella Whitney-West, to kind of piggyback on that, what we're seeing now is, and not only in, we're seeing it in Milwaukee, we're seeing it in Detroit, New Orleans, New York, all these different places. When we're talking about the front line of the pandemic, in terms of those being affected, we're seeing more and more Black people, and it's kind of highlighting the fact that when it comes to care for African Americans, we've always been kind of at the bottom because of different biases and things of that nature. Are you seeing that people are now listening to the story that you've been telling all along, saying these critical care services are most needed, and now they're starting to say, yeah, we've got to take care of the people who are at the bottom of the rung, so to speak?
Well, I think that as Reuben has said, that so North Point and Minnesota Community Care, I mean, we're community health centers, and there are community health centers across the country, and we are actually the largest primary care association in the country. So we have always had that connection with the communities of color, with those communities that are economically challenged. In North Point has been in North Minneapolis for 52 years. Our model is a unique model in that we are really a patient-governed model, in that over 51% of our board members are actual patients. And so that means that we have that direct line to our patients. So that makes us a little bit different. And the community that we serve, they have a relationship with us. They have a trusting relationship with us. I know we work with Hennepin County. They are starting to recognize that as well, that if they are going to have any type of impact on reducing health disparities, that they've got to work with the communities that work within the communities that are experiencing those disparities. And so the African American community, the Hmong community, the Latino community, those are the communities that we serve. And I think what we have done, as Reuben has talked about, the telemedicine. So when we had to close our school-based clinics because the schools closed, we moved our providers into our main campus, and then they start calling. We didn't wait for the patients to call us. They started calling the patients that they've been serving and talking to them, and they really appreciated that connection. asking them how they're doing, asking them what do they need, making sure that they know that we are open. Our food shelf is open, serving the community as well. So it is about being able to meet the community where they are at and becoming that trusted resource. I think that that's why, as Dr. Gilliam has said, that not only have we screened members of our community, we need to do more. There's definitely needs to be more testing. We do tests for the COVID-19. We're not able to process the test. We send it to the hospital, Hennepin Healthcare, or some of you know it as HCMC. But the problem is that there's not enough test kits available. That is the problem. And if people are unable to be tested, then they can't modify their behavior, because as Dr. Gilliam said, there's a number of people that are asymptomatic and have no idea that they have the coronavirus.
Yeah, and it's a shame that we're in a supposed industrialized nation and we can't get the simplest of things, which is the test, which I think would ease a lot of people's fears and angst in this time too. Is just to, even if you did have it, just the knowing of I have it or I don't have it and how to proceed. You had mentioned the your food shelf. Can you give the location for those who might need that assistance, please?
Sure. Well, what I'm going to do is give out our call center number, which is 612-543-2500. That's kind of like the heartbeat of North Point. They can call there. Also for our social services, including our food shelf, that number is 612-767-9500. And then they can get the hours of operation, because I don't want someone just to walk up there and then they're not open, because they continue to adjust their hours as well. But we are located on Golden Valley Road in Penn.
Yeah. And once again, this is the We Good Forum. It is a virtual town hall presented by the African American Leadership Forum, along with North Point Health and Wellness, Minnesota Community Care, and Insight News. We're talking with Reuben Moore, Dr. Kevin Gilliam, and Stella Whitney-West, and we appreciate all the people who have joined the conversation. Again, if you have questions or comments, you can leave the questions or comments within the chat room here on Zoom or on the African American Leadership Forum Facebook page, and they will get those comments to us and we can address them. For all of you, you guys are on the front lines. How's your staff dealing with this in terms of their physical and mental well-being?
You know, between both our organizations, I think, Stella, we have close to 600 staff members. And I can tell you, our staff are just as fractured as everyone else. But one thing we've grown to know about folks who have stood up in federally qualified health centers in the primary care setting, especially for the underserved, we had a courageous bunch of folks. Although we've been shaken, but we're also resilient. We have some folks who will have the underlying health conditions that makes them more vulnerable to this contagion, who said, hey, can we step down? And that's okay too. And so every day is a point of healing. Every day is a point of kind of rejuvenation for our staff. And it's a challenge, right? I got kicked out of the clinics recently, so I'm working from home because folks want me to be safe. That makes me even more nervous, and I'm now more afraid for our staff. And so it's a challenging time period, but we got a really resilient bunch across both organizations. And I'll let Stella speak directly to the North Point team members, but we have a resilient bunch that's ready to kind of take the call to duty.
Well, and I'm gonna also let Dr. Gilliam talk about the staff in the clinic. I am still here on site, even though my office is in the administrative building across the street in our clinic, our main campus. Dr. Gilliam is there. One of the things that we did, and this is really the first week, is we put into place a new staffing model where we operate in teams. And so one team will be on, means that they're in the clinic, they're doing face-to-face visits with patients, while the other team is working off-site at home. It means that they're working, they're doing their work remotely, but they have that opportunity to get a little bit more of relaxation, and they're not in the clinic. It is also a model that we put into place because it allows us that from a safety perspective, public health perspective, should there be a incident in the clinic where there is exposure, then the exposure is with a smaller team. It allows us to get that team out and then to come in, mitigate, do any deep cleaning, and then another team can come in. So I'd like Dr. Gilliam to talk a little bit about how his team is working.
Well, I'm in the clinic today for this call, but I'm on the second team, so I'm technically at home. So I've sequestered myself in my office so that I do not come in contact with anyone that's seeing patients in the clinical area. But it's been, as it is for everyone, it's been fairly stressful because you think about what happens when you go home, potentially if you are exposed here, to kind of bring or take things, back to your home. But as Mr. Moore mentioned, we have a fairly valiant group of folk working here. We've all chosen, to work in this setting. Most of us who are in healthcare do it for these kind of reasons, to kind of stand up when, things are happening that people aren't sure about, that people are worried about, to be available, to be a resource. So everyone is willing to work and to do their part, even if given kind of whatever they have going on personally, they can't be here physically. They are supported in that, and then they support those who are here in person, kind of seeing people and ensuring the kind of health and safety of our community. You're muted.
There we go. I think we're good now. I've got a question from the chat, and it's a question to I guess anyone on the panel, but probably Dr. Gilliam. Are you more worried about the impact of the large number of African Americans who are asthmatic?
Yes. Well, yes. As we think about asthma first, because that's the more common of the kind of the breathing things, but chronic bronchitis, emphysema, also known as chronic obstructive pulmonary disease, is also fairly common in our older populations. Mm-hmm. So as we age, COPD is what we call it, is something that occurs. So if you have COPD or really bad asthma as an older person, so you are at higher risk because you're older. Now you're at even higher risk because you have this chronic lung disease. So yes, to answer the question shortly, I'm concerned about the entirety of the community, asthmatic or not, because as history has shown us, any type of disease tends to impact us more, and for myriad reasons that happens. And fortunately, it has not hit in terms of North Minneapolis or Minneapolis in general as hard in the Black community. But I was driving down Broadway yesterday and I saw large groups of people just collected with each other And the unfortunate thing about this disease is that you can go weeks without knowing anything. So what happens today might be the day you get infected, but you won't know for a week to 2 weeks, which is concerning.
Yeah. We've got another question, and it says, the question is specific to the older members of the families, the ones who value their independence and autonomy and may be reluctant to listen to what their children or grandchildren are telling them to do. How should we talk to the elders in the community who are reluctant to all these societal changes, and what can we do to make them take COVID-19 serious, take it seriously?
Well, I can speak to that because I'm a grandmother, and because I am in healthcare, I do take it seriously. But even as a grandmother, it was my daughter that gave me that wake-up call, because I was experiencing wanting to be around my grandchildren, and she met me at the door. She said, she said, "Where are you going?" And I said, "Well, I'm coming up." She said, "No." She said, "Come on now." They call me Jima. She said, "Come on now, Jima. You know what you're supposed to be doing." I said, "Yeah, you're right." I said, "Okay, I'm going to go home. I'm going to change, shower, do everything." She said, "No, I need you to go home and go to bed." She said, "You can pick up the phone. You can talk to your grandchildren." She said, "We can FaceTime. We can do those kinds of things." She said, "But," she said, "I need you to take care of yourself. I need you to be home." So, so that's what I've been doing. I haven't had that contact for a while. I was thinking, because it was my 9-year-old granddaughter's birthday, that I would get a little break and I would be able to go over there and sing happy birthday. Once again, she met me at the door. I was able to pass on the birthday present, and she sprayed the box. She had her can of Lysol. She sprayed the box.
Good.
And again, I had to wave to my granddaughter from the hallway, and she did kind of try to sneak up and give me a hug, but mom was there blocking. And so, as painful as it was, I got it. I got it. And I said, "You know what? She's absolutely right. She's absolutely right." And I will say this, that, and I was watching, I'm a CNN type person. And so what I appreciate now is they're starting to show the faces behind the numbers.
Mm-hmm.
And we have seen African-American families, we've seen older, younger people who have been impacted by this virus, by this disease. And when you hear about someone being on a ventilator, and you actually understand what that means when they have to puncture you, and that ventilator is actually taking over for your lungs. That is not a pretty sight. And people are dying, young, old. I do believe, because of the data that we're seeing, if you notice, we're not seeing any racial, ethnic data. We're seeing data that shows age.
Mm-hmm.
We're seeing data that shows the number of cases by county. We're even seeing data by gender. So I've asked a question, where is the data on race, ethnicity, both at the state level and at the county level? And the response is, we have it, but we're not ready to release it yet. We want to make sure that it's absolutely right. And I said, well, you need to get the information out, because if people don't see themselves,
Mm-hmm.
they don't believe that it impacts them. So we can't sit around and wait. That's what happened with the HIV epidemic, if folks remember. We didn't think it impacted us. And now that was a mistake, because it was a slow response.
Yeah, the governor holds a 2 p.m. Press call, and it's unique because obviously he's being quarantined, and that's a question that I've been trying to ask the governor, but you can't jump in and ask. You have to be pulled in by the moderator, and thus far I haven't been able to get that question asked. But I do want to see the data behind ethnicity, and as you mentioned, we're starting to see the faces behind the stories. um, we have a story on Insight News' Facebook page talking about the impact it's having on Blacks around the nation. In Milwaukee, as of last Friday, there had been 14 deaths so that's March 27th. Of the 14, 8 were African American. That's 57% in a state that's only 6.7% Black. So that's worrying. And Milwaukee is not unique in that. In Detroit and New Orleans and St. Louis, all these other places. So I too want to see the data for right here in Minnesota um, as well. And then going to your point that you had talked about earlier, um, last Monday I lost my cousin, and not due to the virus, but a loss nonetheless. And he's in St. Louis. I'm in Minnesota. His mom is in another state, and she's by herself. And my first inclination was, okay, well, I'm going to hop on a plane and go to be with my aunt. And everyone said, no, you can't do that, because she's best right now being isolated. That's the way to keep her safe. So it's in navigating all of that as well. And I've heard from other families who are also dealing with loss at this time. So it compounds because you have the loss of the person, and then you have the not being able to commune as we do as members of the family, and especially in the African American community where that's more of a tradition for us, that communal kind of gathering.
And
So,
if I can just add, Harry, so one of the things that um, is coming, and it's here now, and it's going to get worse as the number of deaths, is that we are not going to have the funerals. I tell you right now, in the metro, they are looking at those refrigerated trailers because the morgues are at capacity. They are going to, be virtual if you are able to have a funeral. We're fortunate, Estes Funeral Chapel, they do have the capability of doing virtual funerals, but that takes away, as you said, our cultural rituals that we come together, even, family members that, don't even talk to one another, don't like one another. We come together around those times of sorrow and pain, and we hug and we console each other. You can imagine that the mental, emotional, cultural impact that is going to be for our community, that we are not able to mourn the loss of our loved ones. So that is one of those other tragedies that people aren't talking about, but they soon will be talking about it, because just as you have shared your story, they're not going to be able to come together and bring comfort to one another as we traditionally have done.
mhm. A couple of questions that I want Reuben.
This one hits me home, really personally. Right, on Tuesday, I found out my 46-year-old cousin in Chicago, Illinois, passed of COVID-19. I had been nudging my mom, who I'm the caregiver of here. She lives in my own home, to say, you have to stay in, you have to stay in. But I hadn't met her with compassion and care like I needed to. And I wasn't displaying the right level of caution in a consistent way. So the 3 words I'd say is, we talk to our elders in our community, our family members, our loved ones. We gotta use some compassion and care, whether you use it from their faith-based virtues or hit them in their deepest emotional. level. You know, we got Stella who says she's a grandma. You might have to pull the grandma card. And we have to really, really explain the caution. You know, my 46-year-old cousin was a football star, 6'6", you know, immortal man, and fell to this virus. This is serious. This is real. And we got to be really consistent. I mean, it's every day. We got to practice it. We got to let our friends know every day. We got to let our families know every day that, hey, we have to practice caution in every way, whether washing our hands, avoid touching your face, practicing 6 feet separation, staying at home at all necessary cases, and really protecting our families the best we can. This virus is agnostic to your ethnic background, but you know, as in African Americans, we carry a substantial number of comorbidities, chronic conditions, asthma, other co-occurring diseases that make us more vulnerable for an infection like this one. And so we really need to continue to be compassionate and caring, cautious, and consistent with our elders.
You had touched on something that I was going to ask, and it's just what are those simple, basic practices that we can do to keep ourselves safe and to keep everyone else safe? And you had touched on the washing the hands, and Stella Whitney-West, you had mentioned that your daughter even sprayed the package. Is there any data in terms of like shelf life of the virus when it relates to being on leather or being on metal or being on other surfaces as to how long it can survive?
There is. It's spread essentially 2 different ways that's agreed upon. Essentially, what they call respiratory droplets. So it's, you know, the spit that comes out of your mouth when you talk, cough, sneeze, those kind of things, and then also through hard surfaces. So meaning that those droplets that come out of your mouth, or when you wipe your mouth, you then touch doorknob, which is a hard surface, touch desk, touch computer, touch, you know, anything that we touch is a hard surface. You know, if you sneeze, the thought is sometimes it can just kind of hover right near you for a couple hours if there was no wind or anything. So just in a steady thing. But if it was to be on a doorknob up to 3 days, so 72 hours is what the data suggests at the moment, which is why, so the practice that I have at my house, so when I go home, everything I had on when I was at work gets taken off and gets put somewhere else, and it gets washed or cleaned immediately. Anything that I had there gets wiped down. So my cell phone, all that stuff that might have touched something gets wiped down. And this is after I've washed my hands. Because anytime I change from one area to another, I wash my hands. Any of the doorknobs or things that we all tend to touch, the handrail on the stairs, all those things are wiped down. And, you know, it's hard to come by Clorox wipes right now. So there are formulations of using bleach and water and, you know, some mix to just kind of help to clean, because that does kill the virus. And soap and water is the best thing in terms of removing it and killing it if it's on your hands, because it actually makes it impossible for it to bind. Because if it can't bind, if it can't grab, then it can't get in. So, and then if you are ill, covering coughs, covering sneezes, and if you have the ability to be in a separate place in your home, if you have other folk that live with you, do that and then have them deliver you stuff. I have a colleague whose daughter traveled home and from Ireland. And so for 2 weeks, she's in the upstairs room. Before she got there, they moved a microwave, moved a mini fridge into her room. They placed meals outside her door just to reduce risk. And not everyone has the luxury of being able to do that. But as much as possible, removing yourself from anyone else that might get infected if they were to come in close contact with you. But those real basic things, washing your hands, covering up coughs and sneezes, wiping down things is critical. And then also keeping your distance from folk. And now this does not include necessarily those people that are what we call in your bubble. So like my wife and daughter, we live together. So, you know, unless one of us gets ill, we don't necessarily need to take those extreme precautions, but doing our due diligence to clean commonly touched surfaces, limiting the number of people that come in and out of our home who do not live in our home, because we all kind of have our own exposures, and then you just bring that with you to different areas. So if I invited you over, Harry, then everything that you've been exposed to in your setting would then be brought to mine. So just limiting those exposures as best as we can is some of the basic things.
Yeah. I thought I was a clean person until I started getting psychosomatic. I was like, uh-oh. And then I'm cleaning the doorknobs and cleaning the floor and cleaning any and everything, to the point where eventually my hands, and I had to buy extra lotion because my hands had become chafed from so much hand washing. But I'm still trying to do my part here.
Yeah.
One of the questions I have, all of our families have them. We have those home remedies. You do this and you good. You do that, you good. How do we separate fact from fiction and dispel the myths of this virus and its transmission?
Before I answer that question, I forgot to mention, so once you touch something, and if it's on your hand, it's not the end of the world. Just go wash your hands at that point. Now, what you don't want to do is forget and not wash your hands, and then your eyes gets to itching. I don't know about you, when I started really thinking about not touching my face, my eyes would itch for no good reason. My nose, my mouth would get dry. So so just go wash your hands, because once you touch your mouth, your eyes, your nose, that is how the virus gets in. But then, to your question, I lost it. Remind me real quick.
Kind of the myth, the separating fact from fiction on the virus and transmission.
There is, I never discount what mom and grandma used to do, because there's wisdom in some of those remedies. But I think, looking to trusted sources, so if you are able to tune into something like this, going to trusted websites, like the Minnesota Department of Health, so MDH, or CDC, or HCMC, or, all these healthcare organizations have frequently asked question portions of their sites about COVID-19, about coronavirus. It gives a lot of detailed information, a lot of information on how to, if you feel like you need to be screened, how to go about doing that, where to go. So go online. If you don't know and you need a number to call, the one I know is 612-543-2500. And our call center staff will direct you to someone who can help. I assume Mr. Moore has a number as well of people on his side of town want to call and reach out so they can be directed in the right place. There's a lot of information going around, and it's justified to be concerned. But what we don't want people to do is panic. Just be diligent about kind of your activities and how you approach things. And then, we'll, as we do everything else, we'll make it through. And then we'll just have to figure out what things look like on the other side of this. And unfortunately, no one has a crystal ball, so we don't know. So we take it a day at a time and being planful, so we are prepared for what may happen. And so that's essentially what we're doing, hoping that the numbers are not as bad as they're predicted to be, by taking the steps now that are painful, because I would love to, invite my daughter's grandparents over to the house and all my relatives, but right now we just can't do it. And and it's for everyone's safety because I actually want to see them. What people don't understand is if you're admitted to the hospital, there's one person allowed in the room, maybe. If you're really sick, you might not have a single visitor. And only they make an exception if you are in your last moments of life and a person can come in to sit with you, a single person. I have a friend who's having a baby. So it's not just about, death and dying, but they're good moments as well that cannot be shared in a community because they only allow one person in a room. So mom, mother-in-law, the family cannot see that baby in the hospital, and they won't be able to come see the baby when they get out of the hospital either. You can't have graduations right now. People didn't know their last day of school was going to be March, whatever it was. Those seniors don't get a prom. There's a lot of stuff going on right now that we're still figuring out. But those trusted places that have always been trusted places are where we should go to get our resources. And then, listening to, I don't watch much CNN, but they're pretty good about the information they give out, and the critical appraisal of those who may be giving press conferences and giving out inaccurate information. So making sure you're listening to the back and forth a bit to kind of decipher a bit what is actually true.
In terms of, we look at this virus from a kind of 2 points of context. One is well care, the other is sick care. When we think about well care, those are all the things Dr. Gilliam just described. How do we stay well? And of course, grandma's old remedies might be a part of that wellness approach. Just like the chiropractic, going to the chiropractor or making an adjustment would have been a part of that approach. Going for a walk, laughing, having some fun over the phone with your friends. You got to stay well to keep your immune system healthy as well. But sick care is a little different. And folks who have contracted this virus, every individual biology has responded differently to this virus. So folks have to choose. And the relevant resources available with the CDC, the World Health Organization, or trusted medical institutions to get themselves admitted when they're sick. I don't think there's a magic cure. I don't know. I haven't seen the research that would support a home remedy. So we have to trust our current professionals in the healthcare system to aid us in our sick care response and aid any individual who is diagnosed or has symptoms of COVID-19 today. I've heard myths about vaccinations and things like that. We're going to have to trust the healthcare system at this point because I don't think we can do it on well care alone.
Are you seeing, for instance, now because all the talk is COVID, that doesn't stop any of the other things that are affecting the human body? Are you seeing people who may have are hearing about people who may have other illness but are afraid to present because they don't want to go to the hospital because they think at the hospital all the people with COVID and they don't want to get it that way, so they're delaying care that is possibly needed?
I would say at Minnesota Community Care and our clinics in St. Paul, yes, that is true. And so we're trying to dispel some of those myths. We've built out one of our sites, our 40,000 square foot sites, to just do well care, to do telemedicine. And then if you have to come in for a critical well care visit, say, for instance, you're already, living through HIV/AIDS, for instance, you still need treatment. You still need care. You still need a touch point. And we're here for you. And so it's really critical to get those folks the care that they need. In addition, we have babies being born and that need support. And so we're sending some of our staff out to folks' homes to support the babies being born. We're looking at various strategies to keep folks well, but there is a bit of confusion. Do you go to the doctor or do you not go to the doctor? We think if you have a critical health condition and you need care and it's essential, we'll try to get you some support via telemedicine or otherwise. And we really want you to avoid that emergency room because that's probably not the safest place for you.
Mm-hmm. So I've got a question from the chat in the Zoom chat, and it kind of goes along the lines of understandably so, as Black people, we have a healthy skepticism of a lot of things. We understand that the Tuskegee experiment was real. With that being said, there are members of the African American community who are suspicious of the potential COVID-19 vaccine. And some have said if one is developed and mandated by the government, they won't take it. What are your thoughts on this? Dr.
Well, I can just comment on that, and then I'm sure Dr. Gilliam. So first of all, I doubt if we get into a situation that there's going to be a vaccine that is going to be produced anytime soon. I think they're looking at probably a year out. And I do think that there should be concern about some early type of vaccines or medication, because that is one of the reasons that they want to make sure that they go through enough trials, that there's enough testing, so that the vaccine itself is safe, number one. Number two, when you look at the fact that not too long ago, we didn't have vaccines for measles and other kinds of viruses, and now we do. It is required for children. You can get a waiver, but there's a certain thing that's called herd immunity, right? So that means that if you get enough folks who have immunity to the virus, then it kind of like there's protection for those who don't have it. And I think because this virus is new to us, there is no herd immunity as of yet. They're trying different things, not only the vaccine. I think they're looking at those folks who have recovered from the COVID-19, looking at the antibodies that is in their blood. Can that be used to transfer immunity that they might have to someone else? So I do think people overall do need to be cautious about new treatments and make sure that that they are safe, and make sure that there's enough rigor from scientists. So, and again, going back to those trusted resources.
Yeah, you know, when speaking or thinking about what Stella mentioned about herd immunity, you know, that is something that is a hope that if enough people, you don't need to be immunized to have herd immunity, but if enough people actually get sick and survive, there were some people who just proposed allowing that to happen naturally, and that's where you kind of hear about those larger numbers in terms of impact and death and those things. But when you or a person is infected with the virus, generally your body makes antibodies, so things to help to fight off that virus if it happens again. And we don't know yet how long those antibodies or those things that will protect us will last in the body. For instance, for the flu, if you get a flu shot, it tends to last, you know, for that year, or maybe a little less than that. But we don't know with this particular virus how long it will last. If you are infected, you recover, how much protection do you have? And then there is some aspect of kind of passing that protection on to other people who may be in the community as well. And that's partially how people who choose not to immunize against, you know, measles, mumps, rubella, can be protected in a way because there are enough people around them who are, so they get that herd immunity. And again, a herd is what it sounds like. So, you know, people in large settings, or groups anyway, who transfer the immunity between them by proximity. So yes, because we still, even with other immunizations, don't have 100% acceptance by any group of people. So it's, you know, not necessarily just Black folk. But I agree with Stella. I would keep a close eye on how the process plays out. How particular they are about putting something to market and how rigorous the testing has been. Because there's been experience in history where something has come out and it has had negative consequences on everyone. So I would be mindful of that. And receiving or taking anything, just being diligent about knowing the process and going to those trusted places to see if it's something that actually should be done or considered.
Once again, this is We Good. This is the virtual town hall presented by the African American Leadership Forum, along with North Point Health and Wellness, Minnesota Community Care, and Insight News. We were taking questions on the Zoom chat group, and also I believe there might be questions on the Facebook page as well. Alyssa Paris has been doing a remarkable job of facilitating this this town hall, and we appreciate all that you're doing. So if you happen to have any questions that I'm not seeing, please jump in and let me know, and we'll continue on. One question that we have is the correlation, or if there is a correlation between the chickenpox and COVID-19. Is that data in yet, or are we able to kind of drill down on that?
No, there is nothing to suggest there's a correlation between the two. Outside of there's no correlation between the two. Sometimes they are similarly spread, so you can get chickenpox through kind of respiratory droplet as well, but that is the similarity. That correlation has not been drawn, to my knowledge at this point.
Okay. One of the other things that we were seeing before the virus got to the United States in Italy, and I believe also in France, they were finding that the virus was reacting negatively or more rapidly when someone was taking an NSAID or ibuprofen, and they were suggesting acetaminophen. Do you have any insight on that as well, in terms of if someone does end up with the virus and they've got the fever and they're trying to reduce the fever, what should be the proper protocol?
Well, I saw those studies as well. Currently, the CDC says that there's nothing to support that particular claim. My thinking on it is that if you can get by with Tylenol, which is acetaminophen, do that instead, because we don't know, because there is no evidence to support something, does not mean there is not the other side of that equation. So you want to make sure that if you don't need ibuprofen, if you don't need naproxen, if you don't need Motrin, Advil, Aleve, those are the similar things, don't take them, particularly if you have coronavirus. Now, if you have a fever that is not touched by Tylenol, and the only thing that works for you when you get a fever is ibuprofen, take it, because the last thing you want is to sit around with a 103 fever because you feel horrible, because you get the fever, the chills, headache, body aches, all those things. So to sit in that for so long, your body, it is not a fun time. So I would choose Tylenol over those other things. And then consider also that, if you have heart disease or if you have hypertension, you may not want to take an NSAID. So you may not want to take ibuprofen or Aleve or medicines like that, because they can increase the blood pressure a bit, can sometimes, process through the kidneys, so give you some other issues that you may not want to deal with.
Is there it's very small, but a very small silver lining in all of this, in that we are able to start having these discussions about health in the Black community where we weren't having these discussions prior?
Yes, I guess I would call that a silver lining of it, to kind of looking specifically at our health. because this virus, it impacts our health tremendously. And then looking at those populations of people that we often ignore, even though the people who are listening today kind of love their grandparents and their in-laws. There are older folk in this community who don't have people, who don't have anyone to check in on them. So the push to have people reach out to those older folk in our communities, those people who have disabilities, and paying attention to those who have chronic conditions, is not something that we generally do, because we just kind of have things but go about our regular day. So our diabetes and hypertension and lung disease is not important to everyone else. But now we're thinking about those things and how our health in general impacts how our body is able to respond to an attack. So this gets to the preventative nature of what we try to do in primary care, is try to essentially make it so your temple, your body is as healthy as it can be, so that if something does happen, your body is able to respond in a way so that it's not just getting out and exercising, but that's also putting the right things into your body. So eating all the right stuff. Now, this is something that would have needed to happen before this pandemic started, but it's never too late to make a change, to make an adjustment in how you do stuff. Is no better time than now to learn some new recipes, because we're at home, nothing else to do, but figure out a different way to make what you've always made, but make it a little healthier than you did before. Because you will make it through this, but the diabetes, the hypertension, the lung disease, all those other things will still be there. So learning how to manage those things and to engage with your health is how we survive long-term. Our death rate or lifespan is shorter. The numbers in terms of gaps, in terms of healthcare, are wide in this community, in these communities that we live and serve in. So this hopefully will be a blip on the radar screen, even though it's a fairly large blip and it's a very serious thing. But a much broader issue that we have in terms of healthcare is how serious we take the other things. Because the prevention of this is a behavior change. The prevention of diabetes is a behavior change. The prevention of hypertension is a behavior change. So a lot of the things that we deal with as chronic conditions are treated through behavioral changes that we also have medicines for. But we prefer you eat better, exercise, get some rest, and meditate or do whatever it is to get yourself centered, get some therapy, and not give you medicine if we can.
Reuben, you want to jump in?
Yeah, when I heard that question, I immediately thought to yes, there is some benefits there are a bit of a silver lining for the Black community with this pandemic, and one is for, like Dr. Gilliam mentioned, an increased awareness around health. I've seen the health movement for the last maybe 10 years in the Black community continue to build, and now we're talking about it routinely, whether it be our mental health, our physical health, how we eat, what drugs we take, what chemicals we're using, how we're coping through our pain and historical trauma. Now it's been excited a little bit more, and that's wonderful. In addition, we're starting to think about the many different vulnerable communities, vulnerable populations within our communities, right? Whether it be those who are unsheltered, homeless, our aging, and other disabled and disadvantaged folks in our communities, and we're thinking about them. We're beginning to shift our compassion in different ways. The third thing, I'd say is that we're starting to put our priorities first, right? We're thinking about our family members, staying home, probably refocusing a little bit more. And I think our community needed a bit of a slowdown.
Yeah.
And if I could add, Harry, real quickly, if nothing else, we have learned or should know how to wash our hands. The proper way to wash your hands, people are going to be looking at each other, and it's like, okay, no, I'm sorry, that was only 10 seconds. I need you to do 20. Little children learning how to wash their hands to whatever song, but understanding that because this is going to come again. There's not going to be the normal. It is going to be this new normal. And that is that we know that we have to protect ourselves, washing our hands, using disinfectant, knowing that it needs to be at least 60% ethanol, check the ingredients, making sure, and that whole thing about, I don't like to call it social distancing, but physical distancing. You know, there's gonna be a while where folks are gonna be, you know, everybody is not gonna be you're not gonna get a hug and a kiss from, because it's gonna be, okay, wait a minute, you know, learning not to touch our faces and things of that nature. So that, if there's any silver lining, that is a silver lining, something that we should have been doing all along, but now it's gonna be imperative that we do that.
Once again, we're monitoring for questions here on the Zoom chat as well on Facebook. One of the questions is, would increasing the intake of vitamin C be helpful in fighting the virus?
I cannot say that it won't. So sure, you know, try. I know we are taking extra vitamins at my house, and you know, just anything to kind of boost the immune system in some way, whether proven or not. If it does not have harm, you know, we're doing those. So we all are taking an extra Flintstone a day to, you know, kind of keep the micronutrients and things kind of built up outside of regular diet stuff.
Yeah, before all this occurred, I had started taking extra vitamin D because I noticed that my mood was off just because not having that exposure to the sun in winter months. So now it's the D, the C, the multivitamins, and such. They also have a question about masks. Should we be wearing masks?
That's a hot question. I know there's currently, I heard this morning, the CDC is reconsidering their position on that. And it makes sense that, you know, if we're trying to decrease the amount of spread in the community, where it comes from is essentially people's mouths, and, you know, from the respiratory droplets. So we are able to block that particular transmission. You would presume that would lower the rate of transmission, because there are so many people who walk around and don't have symptoms. It makes sense to me to recommend that people mask. I know there's a question about whether you can make your own, or, you know, I think the thinking is that if you do make your own, it will not necessarily protect you from getting the virus, but it will keep you from spreading, potentially, if you wear it correctly, to other people, because it will prevent you from kind of spreading the respiratory droplets and all that. You know, so I think whenever they come out, you know, I don't work for them, but I assume they may change their recommendation soon.
So this is Stella. What I would recommend is that I would encourage people you can go to the CDC website. There's instructions on there about making homemade masks. I know that there are people who are doing that and donating them. Whereas in the clinical setting, we have particular type of masks that we have to use. So I would encourage people that if they want to wear a mask in their everyday interactions, get a homemade mask, because right now there's a shortage. There's a shortage of supplies, and we first started noticing it back in January when we could not get our usual vendors. And so the healthcare workers are on the front line. The first responders are on the front lines. They need those masks. And so we encourage the community, the public. You certainly want someone who's going to show up for you to have on the proper mask. You're going to look at them pretty suspect if they got on a homemade mask. So that's okay if you go into the grocery store, but when you come into the clinic, or the EMTs are coming to your house, you want them to have the proper mask. So we encourage people, don't buy up the small amount of supply that is out there, because the healthcare workers, we need those masks.
And that just demonstrates this is me editorializing, but that just demonstrates the failure from the top down, that we cannot provide those on the front line with just the basic necessities to combat this virus, and it's shameful. I'm just looking, I have a screen behind me, and I'm looking, and it's showing the worldwide death toll at 49,000 people from COVID-19. In the US, which didn't have its first, I guess, death until early March or the last day of February, is now above 5,000. So we account for more than 10% of all total deaths from COVID-19. And so it really is just sobering to see those statistics when they pop up like that. And then to know that we're not providing our frontline workers with every utility possible is shameful. And I'll hop off my soapbox. Let's see. I think I've got another question. Should you disinfect your groceries? And how should you handle items brought from the store?
So this is what I would recommend. And again, if you have the disinfectant wipes, or if you make your own, go ahead, wipe them down. That is perfectly safe and recommended, just to make sure, because you don't know who was the last person to touch that box. Maybe they didn't practice the proper way to sneeze or cough, and they may have coughed into their hand, and then they touched that package, and then you come along, you buy the package, but you can wipe it down. And even before you bring it home, again, careful on how you're picking up packages. Many people, that hand sanitizer and the wipes that they have in the grocery stores, use them to make sure that what you are bringing home is safe.
I agree. Also, wiping down any packages you get delivered. If you had something delivered to your house, when you bring it in, wipe it down, and then go wash your hands. This is a new time, so we kind of have to change how we do things, and you don't realize how much of the stuff that we touch, someone else touches until you start thinking about it. So just run down that rabbit hole.
I know when I go to the store, cilantro is one of my favorite herbs. I love it. And it sits out there in the open, and I decided I was going to take a pass on cilantro for a while, because my mind went to how many people dug through, and so and then I got some jalapenos, and I literally said, okay, I really do want the jalapenos. I can feel comfortable in literally washing them with soap and water and then rinsing them before I use them.
Yeah, I mean, the hope is that in a few weeks or a few months, we look back on this conversation and say, you guys were crazy for thinking of doing all that stuff. That will be the hope. But not knowing how this will all end, that practice is a very good one to kind of keep and maintain, particularly as it's been titled, it's novel, it's new. We have no idea what's coming. We've seen what it's done in other countries. So it's only good practice to take these measures?
Again, this town hall is presented by the African American Leadership Forum, along with North Point Health and Wellness, Minnesota Community Care, and Insight News. And it is, we're trying to provide as much comprehensive information to our community as possible. If you have any questions or comments, feel free. We've got a couple more minutes to get them in. It's been a very robust conversation, and we just want to make sure that we're getting all the information to you, the viewer and listener, that we can possibly give you to arm you to hopefully not come in contact with the virus. But if you do get the virus, what are your best practices to deal with it once you get it? So,
and Harry, can I just add, and I always remind people of this. Number one, look at the leadership. If you do not like what's going on, and you don't feel that they're protecting your community, you do have a weapon. It is your vote. Make sure that you are voting. We have the census that is opened up. Please, please complete the census. It is important because that is how dollars flow into our community. So we can all do our part on that level. Let's make sure that we are politically engaged, that we are aware, and that we're encouraging others in our community to do the same.
yes, absolutely. We've had a very informative 90 minutes worth of conversation, and that is thanks to the African American Leadership Forum. It's thanks to Stella Whitney-West, CEO of North Point Health and Wellness, Dr. Kevin Gilliam of North Point Health and Wellness, Reuben Moore of Minnesota Community Care, and my name is Harry Colbert. I'm the managing editor with Insight News. What I'd ask you to do is also please continue to reach out to all of us as valued community resources. If you're not a member of the African American Leadership Forum, please consider becoming a member. Also, if you have any other questions that we did not get a chance to address, if you don't mind, can you give the phone number again over at North Point and over at Minnesota Community Care?
Yeah, for Minnesota Community Care, to get the most updated information, please just try our website, www.mncare.org. It's really simple, mncare.org. We'll have updated information right on our landing page.
And the same for North Point. So our website, www.northpointhealth.org, will have all of our information as well as our phone number. So our call center, 612-543-2500.
And for Insight News, it is insightnews.com, and you can also find us on our Facebook page and Twitter at Insight News. Once again, we thank you all for participating, and we thank the community for joining in with their comments, questions, and their eyes and ears. Everyone, please do everything that we can to stay safe and emerge on the other side. Thank you so much.